You know, it occurs to me we might want to share the screen. Do we have these things to share on the screen, Melissa?
Yes, I believe we do.
It might be worth sharing with everybody so that while I'm saying it, they're also reading it.
And we're live.
Okay, I'm going to start the Health and Government Operations Committee. First public hearing of the 2021 is now in session, and having no gavel, I'm going to go. Hopefully we're posting the committee guidelines at the start of this meeting in the next few minutes, but meanwhile, I'll read them. All the bills we're hearing today will be sponsor only. These bills were all voted successfully out of the HGO committee in the previous session. Bill sponsor panel timing. The bill sponsor or a designee is allotted 5 minutes to present the bill. Other bill sponsor panel witnesses will be allowed 2 minutes each to present oral testimony. Individual witness timing. Individuals will be allotted 2 minutes each to present oral testimony. Please conclude your remarks when you hear the timer. Members must remain present with your video cameras on during the entirety of the hearing. And please ask only one question of one person on the panel. If you have other questions, please follow up offline. And with that, I want to start by getting rid of that, perfect, and saying thank you to Isha Yardi for being here and timing for us, and thank you to my vice chairman for sharing her with us today. I really appreciate that. With that, the first bill of the day is House Bill 130. And unfortunately, my list doesn't have who that is, but I think it's Delegate Chi. Is that correct?
Yes. All right, let me get started. Thank you.
Please.
Happy New Year, everyone. Good afternoon, Madams Chair and the Vice Chair. I'm excited to just say that. I am Delegate Lily Chi, and I'm very happy to be here to present my very first bill for the 2021 session with HGO. HB 130 will establish a Governor's Commission on LGBTQ affairs to assess and address the needs of our diverse LGBTQ Marylanders, to coordinate the work across government agencies and community service providers, and to track and report progress. But most importantly, the Commission will serve as a home and a bridge for the LGBTQ communities and those who love, serve, and care about them. Thanks to this committee, this bill passed the House with bipartisan support in the last session. The only change this year is explicitly stating that 2 of the 15 member seats on the commission would be representatives of the transgender community, which is disproportionately the target of bigotry, hatred, and violence. Both last year and this year, we received broad-based support that speaks to the pent-up demand for a body like this inside the state government. I want to take a moment to acknowledge those who sent their written statements for this bill, for this sponsor-only bill hearing. They are Planned Parenthood of Maryland, Maryland Human Trafficking Task Force, the Maryland State Education Association, Kaiser Permanente, LGBTQ Democrats of Montgomery County, Baltimore City Commission of LGBTQ Affairs in the Mayor's Office, Free State Justice, and finally, Mogul Pride Center. Let me just articulate 3 reasons why we need this commission now. And I'm quoting from some of the supporting written testimonies because not all of them were able to upload their testimonies for you to read ahead of time. Maryland in the past decade has made great strides to protect the equal rights of the LGBTQ communities, but we're just middle of the pack nationally as a state. In fact, 13 other states are ahead of us, according to the Human Rights Council's annual State Equality Index. And it's not enough, as we all know, to pass laws and adopt pro-LGBTQ community policies if we don't know how these policies have been implemented or how our communities are actually benefiting from them. Nor do we have a systemic way of assessing the changing needs to inform our policy decisions. And homophobia and transphobia persists in our society in every aspect of our lives. According to the FBI report, in just 2020 alone, hate crimes against the LGBTQ individuals increased by over 16%, reaching the highest level in a decade, including violent crimes like a murder of gender nonconforming individuals. And other examples include LGBTQ youth, in particular, are overrepresented among runaways and homeless youth populations as they experience family rejection, harassment, violence, and economic instability. Sadly, the perpetrators are often their teachers, their doctors, their supervisors, their landlords, and even their family members. When a Salisbury public school parent discussed the safety concerns of their child, the principal told the parent to just move to a more metropolitan area. And a Wycomico doctor told his patient to leave his office when she told him that she was a lesbian. LGBTQ Marylanders exist in every county, but most communities don't have local government infrastructure or community resources to help them. The city of Baltimore is the only local jurisdiction in Maryland with its local commission. An easily identifiable state commission is an important step toward addressing that void. Finally, this commission is modeled after two existing state-level LGBTQ commissions. The state of Pennsylvania had the nation's first state-level commission in 2018, and the Washington's commission was established in 2019 by legislative action. As a mother of a gay son, I want my state to be among the most inclusive and the most competitive in attracting talents of all backgrounds, so Marylanders like him could thrive here and live with dignity, just like the rest of us. The needs are great. The fiscal note is minimal, I have to point out, and the time is past due. I urge you a very favorable report. Thank you very much.
Thank you, Delegate Chi. We really appreciate your testimony and your personal perspective. Thank you for sharing that. Are there questions of the delegate? Oops, I have to open up my participant box. Okay, I see no questions. I suspect that this will go to subcommittee to look at the amendment that has been made, the one change. I expect that it will be on a voting list fairly soon. We passed it last year, and I thank you very much for your testimony today.
Thank you so much.
You're welcome. Since that's sponsor only, that ends the hearing on House Bill 130. With that, we'll turn to House Bill 224. Delegate Krebs.
Thank you, Madam Chair. Welcome back, colleagues. House Bill 224 is a bill that we passed last year. I just want to remind you, this bill is more pertinent now than ever. House Bill 224 is a study of a common information technology platform for our Health Occupations Board. For you those of you who are new to the committee, our Health Occupation Boards are all independent boards, and they have a little bit of structure and support from the state, but basically they're independent boards. And over the years, I think we've seen some need for streamlining to ensure that all the boards are operating similarly, making sure agendas are posted. Nowadays, having virtual meetings available with certain technology is more than something we didn't even talk about last year when we passed this bill. But I think now more than ever, we'd like to have a study just to see how we could offer a common platform to our boards, and hopefully they'd see the benefits of it. So this bill is the exact same that we voted through committee on the House floor last year. It never made it over to the Senate, and it would just require a study to be sent to us by next December, so that during the next legislative session, we could decide how to move forward from there. And it would basically allow Department of Information Technology, to study the core administrative functions, including but not limited to uniform licensing, scheduling, agendas, public notices, and a website. This past year, and last couple of years, the Board of Nursing has been working with DoIT on a one-step program to implement with regard to licensing, because the Board of Nursing has 300,000 licensees, and they're looking at an efficient way to do that. So this would basically require the department, in consultation with the boards, they would go out and talk to the different boards and see what their needs are, and they would review the technology platforms used by each board currently and make recommendations on the feasibility and cost of developing this common and standardized platform by each board. And they will, again, submit their findings back to us by next year. Many of the platforms that our boards currently use, some of our boards are very, very small. They have very few number of licensees, and it's very expensive for them to maintain their platforms. So many of these platforms are outdated, inefficient, or not able to provide the level of needed services that many of the that we now need, especially with regard to everything being virtual. And I think in the future, we're going to see moving forward that we're going to have more virtual board meetings, because people come from all over the state, and you shouldn't have to drive 3 hours from Eastern Shore, Western Marin, Lower Montgomery County to attend a board meeting. It'd be great to be able to participate in the future as they are now to be able to attend these meetings. Also, we think there's going to be some cost savings for the different boards, because now they all pay separate vendors to maintain these systems. You should, even though you don't have my testimony because we were late getting it posted yesterday, that's just what it says. You should have a letter in the file from Maryland Department of Information Technology, basically encouraging us. They're trying to find ways to standardize our IT system through state government. And you can tell over the last few years that our administrative offices, our different departments have very similar looking websites. It's easy to navigate. And we want to do that the same with our health occupation boards. I think it's just more professional. It's more efficient. So a good first step is just recognizing that standardization and letting do it, find the areas where they can help them in a more efficient manner, saving taxpayer money and making more transparency and accessibility to those who want to access these health occupation boards. The other issue that came up this year that we didn't talk about last year is security of these platforms. I mean, with all the different problems that we've had with security, it'd be better than all the different boards having their own person, that we have one secure type of platform to work with across all different boards. You also have a letter in there from the Maryland Department of Health, basically encouraging the benefits and the economies of scale and a common platform with technology constantly changing. And you can read their testimony. So there has been some resistance from the boards in the past to being forced into this kind of platform. That's why we want to do a study first and show how we could offer these independent boards benefits, and instead of pushing them and just telling them that they have to do it. So I think that is an easier way to entice the boards to come on board with us. We also have a letter from the Maryland Healthcare Commission offering their support for it, especially with the licensure, to make sure it's consistent and it would be achieve greater efficiency with the common infrastructure. There's a letter from the Board of Nursing, the Nurses Association, I'm sorry, who is working on this themselves. So please, we'll just, I think it's needed more now than ever. And I hope the committee, I know we will pass this again and get it through the Senate this year and get this moving. So with that, Madam Chair, thank you very much. Can't hear you.
Thank you very much, Delegate Krebs, for your work on this issue. Are there questions of Delegate Krebs? Seeing none in my box here. Thank you. That ends the hearing on House Bill 224. And again, there aren't even any changes in this bill, are there, Delegate Krebs? Okay, well, I think that this one will probably skip subcommittee, and you can expect to see us voting on it as soon as we're voting. Thank you very much. That ends the hearing on House Bill 224, and we'll now move to House Bill 290. Delegate Hill.
Okay, I'm unmuted. Thank you, Madam Chair. Good afternoon, colleagues and public. I'm here to present House Bill 290, Employment Discrimination Time for Filing Complaints. This bill increases the time for filing a complaint with the Maryland Commission on Civil Rights that alleges an unlawful employment practice other than harassment, and it increases it to 300 days from the current term. And this bill was passed without without any nay votes, 23-0 from this committee last year in the exact same posture. The bill, only slightly different, was also passed from this committee in 1990, with the only amendment being to make the 2020 bill and this current bill align with recent statutory changes. And it passed out of the House the last session 130-0 and got caught up. So essentially, I'm asking that the committee look at the work that it did on this bill the last 2 years and pass it again. Thank you. We had a letter of support from the commission. I think you'll see the fiscal note shows you that we expect there to be no effect and essentially no cost. Unfortunately, the support letter this year did not get in time. That's it.
Chair Pendergast, you have to unmute yourself.
Yeah, I keep making that mistake. I'm sorry. Thank you very much, Delegate Hill. Are there questions of Delegate Hill? Oh, I see Delegate Saab, you have a question.
He's applauding me.
Thank you,
Oh.
Madam Chairman. I just have a quick question for the sponsor. Was there any amendments to this bill last year?
Yes, so last year, the bill was amended from 2019 to bring it into compliance with legislation that was separately passed in 2019. But there's no difference between the bill as introduced this year and what we passed last year.
Okay, thank you. Thank you, Madam Chairman.
Thank you, Delegate Saab. And remember, you did a great job of putting your hand up. Don't forget to take your hand down when your questions are answered. And Delegate Hill, thank you very much for your succinct and good testimony. Just hit the nail on the head. A good model for everyone.
I want credit going forward, Madam Chair. I want credit going forward.
Don't push your luck. Seeing no other questions, that ends the hearing on House Bill 290. And again, that bill will be up for a vote, thanks to your enabling us to vote and hold the bills for a while till they can go to the floor. So we'll be voting on that in the very near future. Thank you. House Bill 321, Delegate Ebersol.
Thank you, Madam Chair. The theme today is bills that you've seen before. I bring to you House Bill 321, which is a repeat of House Bill 10 from last year. This is a bill regarding creating changing facilities for the adult disabled in the state of Maryland. As disabled individuals grow to be adults, families and caretakers face new challenges, and among them, hygiene. When a diaper needs to be changed, certainly the facilities at home allow this to be accomplished in a respectful and physically manageable manner as possible. However, once out of the home setting, the challenges become greater. Imagine the difficulty, not to mention the indignity, of making a diaper change on a bathroom floor or on a parking lot next to an automobile or even in a picnic area. And so it is probably unnecessary to go into any further detail to the personal humiliation, not to mention the difficulty for the caretakers and for the individual. We can make this process easier for everyone. This legislation seeks to require public buildings that are newly constructed or undergoing significant renovation to include adult changing tables. Additionally, the availability and location of such facilities would be an aid to families, especially if they're traveling or going on outings. And then the legislation requires the managing organization, I have to write it down because it changed. We changed it last year, Department of Health, through the 211 to keep a clearinghouse, a website of the details of locations and hours of public buildings that have such facilities. And this will allow anticipation among those impacted of how to deal with the needs that arise while traveling. You may remember last year a moving testimony by my good friend Julie Bainbridge and her son Charlie, who's just turned 20 this year, and taking care of him and how much she would like to be able to travel. Now, they haven't traveled too much this year, to be sure, but going forward, we'd like that to be something that they could do with some ease in the state of Maryland. And as I say, this only applies to new buildings or buildings that are having substantial renovations being done, allowing for a changing table that can accommodate an adult. And with that, I'll see if I can eclipse my good District 12 colleague, Delegate Hill, with a shorter testimony or not.
Okay. Are there questions about this bill? I see no hands up in my panel. So I will say to you the same thing that I've said to all so far. Thank you very much for your testimony. It was, again, also succinct. You did a good job competing with your district mate. And we will be dealing with this bill very soon. Since there are no changes, we will hope to be voting on it at our first voting session.
Thank you very much. And I thank you all for your swift work on it last year as well.
Pleasure to see you.
Cheers.
That ends the hearing on House Bill 321, and that actually ends the work of the day. I will, before signing off, say that if you have questions about what we've just done, obviously you can call me, you can text me, or you can ask them right now if they're generic to hearings. But if you want to take it offline, if you have questions, that's fine. Thank you this morning for the organizational meeting, the help that you gave me so that we were more prepared for things going forward. Isha, you didn't have to do much, did you?
No, I had the timer going, but everyone was under 5 minutes, so.
Good. Well, that's perfect. And I thank you so much for helping us out today. And with that, enjoy the rest of your afternoon. I don't know that we'll be getting out this early in future, so enjoy it while you can. Thank you, everybody.